Ken Thorpe. I'm the chairman of the Partnership to Fight Chronic Disease, located in Washington, D.C. Well, we released the blueprint today on how to reform the Indian healthcare system. We viewed it as an action strategy. The partnership has been doing work in India for 5 or 6 years. We spent the initial time just outlining the problem. And the significance of the blueprint is that we finally outlined an action strategy. That is, what can the states and what can the government of India and what the private sector can do in order to slow the growth in the number of NCDs, but also do a better job of preventing, earlier detection, but better patient engagement, working with patients that have multiple NCDs to keep them healthy. Well, PFCD has played a convening role in several countries. So one of the things that we started 6 or 7 years ago was that we convened people who hadn't been basically sitting down at the same table to think about the problem. So that includes the state governments, the government of India, and the private sector as well. So we started as basically to get the thought leaders together to identify the magnitude of the problem, and as we released today, to actually have an action plan about how to solve the problem of NCDs. Well, I think the states can learn from each other in terms of best practices and what works in terms of preventing and managing patients that have NCDs. So our blueprint has several really good examples, I think, of health and wellness centers, NCD centers, that we think we can replicate in different parts of the country, in urban areas and rural areas. So we've really pulled together, I think, some of the best practices that states can look at and see how they can adopt and implement some of these best practices approaches to managing and preventing NCDs in their own state. Well, the blueprint includes several best practice examples of how to prevent and how to manage NCDs. And so we've gone throughout the country and identified which we think are several promising best practices on health and wellness centers and on NCD centers to treat and prevent NCDs. So one of the big advantages of our blueprint is that the states can look at this. They can learn from each other on what has worked well in rural areas, what has worked well in urban areas, and states that don't really have the NCD treatment capacity can take some of those best practice models and replicate them and scale them throughout their own states. Well, I think there's sort of two issues. We only solve this issue if we have real devotion and thought leadership from the very top, and it seems like the government of India really has doubled down on trying to really invest in the health sector and solve this problem. So it starts with leadership, and it starts with thought leadership at the top. The second challenge is going to be the financing. The Indian healthcare system is woefully underfinanced. It doesn't have the capacity in terms of the underlying infrastructure to prevent and manage NCDs. It doesn't have the appropriate manpower in terms of primary care physicians, nurses, and nurse practitioners. It just doesn't have the facilities and clinics necessary to deal with the problem. So the government of India is going to have to, over a time period, increase its investment in the health sector from roughly about 1% of GDP today to, we think, about 3% of GDP over the next 7 or 8 years. Well, this has got to be a public-private partnership. I mean, the government of India and the states can't solve the burden of NCDs alone. So we're going to have to find creative ways to engage the private sector. For example, either through tax incentives or other types of easier access to capital, we want to get the private sector to actually invest in and build some of these NCD clinics, to help build the infrastructure to treat and manage patients, perhaps expand the availability and use of private health insurance that is currently available. So I think both in private investment, building up innovative financing models, perhaps monthly subscription fees paid to these clinics, but we've got to create a business environment that makes it attractive for business to invest in the infrastructure. Well, I think the way forward now is to work again with the thought leaders that we've been working with over the last 18 months. So that's the government of India, several state leaders, and the key thought leaders in the private sector. So we've laid out a blueprint. Now we'd like to sit down with them and really figure out what's an implementation strategy. So that'll start with working with the government of India as they're developing their health plan right now. And so we've been going back and forth and sharing ideas with the hope that many things that we have in our blueprint will find its way into the future plans for the government of India's health reform package. Well, it's taking place, but they're doing the thinking right now. So they're pulling together a healthcare reform package. We got ours out early, so that some of the ideas that we've developed, we hope can be a part of what the government of India is proposing.